Good afternoon.
Good afternoon.
Thank you for joining us. It's nice to have everybody here. And just to make sure you're in the right workshop, you're in workshop K, and we'll be talking about the focus on multiple factors of health, sharing the successes from the Robert Wood Johnson Foundation Community Prize winners. So my name is Kitty Jerome. I am 3 weeks into my new position at the University of Wisconsin-Madison, where I work with county health rankings and roadmaps to health. I ask your forbearance if I stumble a little bit because, as I said, I'm 3 weeks into a move from Massachusetts, where I've lived most of my life, to Wisconsin and a new job. But I have had the pleasure of working with the panelists here today over the past year as they rose to success with their Community Prize Awards from Robert Wood Johnson Foundation. And so it's a pleasure to be back here with Wendy Garth-Lipp from United Neighbors Fall River and Claude Jacob from the Cambridge Health Alliance. And so we're going to give them most of the highlight time. I just want to provide a little context to the room and talk a little bit about what this prize was and where it comes from. And there's plenty more chairs, and we won't bite if you have to get up and leave or something, so feel free to come on up. So I'm going to assume that most people are familiar at least with the concept of the county health rankings. Have you heard about it? Is there anyone who has not heard of the county health rankings? And don't be shy. Okay. So there's some of you who have not. So just a real quick background, since I have an exhibit booth out here. There's more material at the back of the room. You can grab some and take it with you, and you'll learn a lot more about it by going to the website, which is countyhealthrankings.org. Very easy one to get to. The rankings began in Wisconsin when Wisconsin ranked every county in their state for health outcomes, looking at both morbidity and mortality. Around 2006, 2007, they started branching out. Some other states are interested in this. By 2009, Robert Wood Johnson Foundation had joined with the University of Wisconsin Population Health Institute in a partnership, a co-funded, co-branded partnership to rank every county in the country. So these rankings, we don't actually create the data, we compile the data. So the rankings are compiled from 11 or 12 credible sources regularly each year. And that compilation gives a number for each of many health factors in every county around the country. And the focus is, once we have a number, we can compare within our state, well, how well are we doing compared to the other counties in our state? And in Massachusetts, of course, we have geographic counties. Some people say, well, we don't have counties. Well, we do have counties. We don't have county government or governance, but we do have the counties, and so we are ranked by county. But then once you have that number, what can you do with that number? So people were excited to see that they could compare across the state. They could say, wow, that community is doing a lot better on high school graduation rates than we are. I wonder what they're doing. We could check it out because we're doing really poorly on it. Or that community has a diabetes prevention program that seems to be working. Let's see what they're about. So we could start to build a network that way, but we really needed more than just the number. And so in 2010, we began the County Health Roadmaps to Health. And the Roadmaps to Health take the number, say, so what? What can we do with that? We can do community work. We can do community health improvement, and we will garner some resources to help communities to do that. And so Roadmaps to Health now was born and began to blossom with a number of different initiatives to help communities do better with their numbers, basically. And so Roadmaps to Health has community partners who are national partners. So we're working with United Way as one of our national partners, the National Association of Counties, the National Business Coalition on Health, beginning to branch into other sectors beyond just public health, but looking at government, business, education, people who work on criminal safety, community safety, people who work in all different sectors around the factors that we know influence health outcomes. Because one of the models that we use at County Health Rankings shows us that the social and economic factors of income and education, income and employment, education, community safety, and social and community support, that those factors make up about 40% of the impact on health outcomes. And so we want to focus there even more than health behaviors, actually, that we have traditionally in public health been focused on. We know that that work requires working with everyone. So we have partners, we have community grants that are going out of Community Catalyst in Boston was chosen as the national site to provide the community grants and provide technical assistance to those grantees. We have an online action center resource, which is tools, activities, readings, a whole host of material for communities to dive into according to their topic area that they're interested in, or according to where their coalition is in the process, if you're assessing information or if you're choosing your priority, if you're beginning to act or you're implementing that action, or you're evaluating that action. So a whole host of materials. We have coaches who are serving as experienced guides. You can have a 1, 2, or 3 time conversation with a coach who will follow your progress and provide some assistance pointing you to the right tools for the right stage that you're in. We're launching a new coaching program actually today. The informational webinar is going on right now, but it will be archived on our website, so people will be able to check in and see if your team or your community or your partnership is appropriate for that kind of more intensive coaching. That's a one-on-one over 6 to 8 months working with a team. But we, throughout all of this, we knew that we really didn't need to just help people. People were already doing a great job. And so we knew that there were communities that were doing fabulous work. And we looked all around and developed a prize to reward 6 communities nationally each year that are doing fabulous work, looking across all of those factors, working with different stakeholders from different fields of effort, and succeeding in their efforts in changing health outcomes in their communities. So that was a competitive award application. There are more seats up front if you want to come on up. Won't bite. There was a competitive application process for the prize. We had, I think, about 170 applicants the first year. We awarded to 6 communities, as I said. We had 11 finalists nationally. Now I have to pause, drum roll. 3 of the 11 were from Massachusetts. So are we doing a good job in the Commonwealth? Yes. We had Somerville, Cambridge, and Fall River came in as finalists as among the 11 finalists. So that even the reviewers, the folks at Robert Johnson, everybody, big debate. Can we choose 3 from the same state when we've got all these other 49 others that are still applying? They did, and they went and conducted site visits, on-site 2-day intensive visits with community forums and lots of in-depth questions to each of those communities, and then chose 6 of the communities, and 2 of them are sitting here today with you. So Cambridge and Fall River were awarded the prize last February in Princeton, New Jersey, at the headquarters of the Robert Wood Johnson Foundation. We had a big gala affair, a lot of press, a lot of work. And we're now relying on the prize winners to help us share the story of their success wherever we can. So whenever we find opportunities, we have prize winners getting together in different configurations to chat a little bit with folks about what they've done. At the end of this workshop, I'll tell you a little bit more about the next round of prize, which is underway right now. The site visits just started this week, so they're right now going out to 12 communities nationally to choose the next set of prize winners. This year, I think they felt we were a little overrepresented. We don't have any Massachusetts in this year, but there's another year coming afterwards, so I'll talk more about that. But we want to share the story of the prize winners and talk a little bit about it. We've got a couple, I want to just run through quickly the criteria we had for the prize that really highlight the work that these communities are doing. Excuse me for turning to my notes here. But the themes that we saw were that people were, and these are the themes from the applications we read, that people were caring deeply about their communities. They knew that they needed to care deeply, and they weren't afraid to show it. And that's what was great. They were broadcasting it. It's a big piece of what the prize is about. Is so often in public health, especially, I think we hide the light a little bit. And this was about broadcasting the work that's being done. Leadership centers on bringing and keeping people working together. So we do know that, and this was shown very clearly in the prize. Partnership means relationship. There is meaningful but not token engagement of the whole community. Policy systems, environmental change is a way of doing business in the communities that really succeeded. Focus first and the resources will come. many of the communities were not funded for all of the work they were doing. They focused on the work they were doing, and resources came to them when they needed it most. They care and demonstrate whether they're making a difference, and the whole is greater than the parts. These were key themes. So we looked really carefully at the shared vision, the strong leadership, and a commitment to making those needed and lasting changes. The first two prize criteria relate to the theme of this conference. We're harnessing the collective power of leaders, partners, and community, and implementing a strategic approach to improving health that focuses on the multiple factors that influence health. We also looked for those who are addressing problems that disproportionately affect the vulnerable populations, developing sustainable long-term solutions to shared community priorities, securing and making the most of available resources, and measuring and sharing results. So now I want you to hear from them. And we've got, we don't have PowerPoint today, but we will show a couple of videos sprinkled throughout the presentation so that you can see a little visual to go with the work. But first up is Fall River. So Wendy Garlipp is the Executive Director of United Neighbors of Fall River and the Community Connections Coalition. United Neighbors works to towards secure and stable families and the promotion of peace and tranquility and optimum family support. They also support the Greater Fall Rivers Partners for a Healthier Community. We have the director of that organization in the room as well, and they were the winners, the actual prize-winning organization of Fall River. Wendy is a community collaborator on a grand scale. She has many varied pieces of history that have given her this experience, including living in the Middle East for about 7 years and working for some of that time on a peacekeeping task force. And she and her husband raise chickens and turkeys, and one of her personal missions is to teach people to can and preserve the bounty from their gardens, which I think is a fabulous mission. So please welcome Wendy. Wendy, I'll just ask you to give a few words of introduction to the video, and then we'll start the video of Fall River so people see a picture of it.
Sure. Hi, everyone. Thanks so much for coming. We were worried that no one would show, so you've made us feel very happy. If you notice, under my name, there are two organizations, and that's because although I am the Executive Director of United Neighbors, Greater Fall River Partners for a Healthier Community is the organization, the coalition, that applied for this award. We are, people always ask us, what does your office look like? And we always show them a vacant lot because we don't have an office. We are a coalition. We are the CHNA, the Community Health Network area in Fall River, and we are made up of about 60 different organizations that come together. So we were the only non-physical organization that applied for, that won one of these awards, and that changes a little bit of the work we do. So we'll just look at the video.
Yeah.
Winning the Roadmaps to Health Prize really recognizes the community's efforts over the past number of years on addressing some of the most challenging health problems that we have here. The health of this community is very much reflective of the economy. Fall River is a working class community. It's been a mill town for the past 150 years. We struggle with employment issues here along with the poor economy.
One of the things that's amazing about Fall River is the community collaboration that exists here. We've been able to bring together a coalition that doesn't look at just one problem, be it health, poverty, lack of education, lack of community support, good housing, a job. All of that leads to having a healthy community.
One of our major goals in addressing health disparities is improving access to health care in some of our poorest neighborhoods.
Hi, can I help you?
The Health First Clinic is a state-of-the-art, community-based clinic that serves primarily the low-income community.
Could you just break it up for me, please? Although many communities have clinics, what makes this so extraordinary is the fact that in one building we were able to bring a variety of different organizations and a pharmacy and place it in the neighborhood in Fall River that needs it the most.
One of our most successful efforts has been the Fall River Fitness Challenge. We began 5 years ago to bring hundreds of people into the program that introduces them to physical fitness and exercise and improved nutrition.
The goal is to not only help people get healthy, lose weight, and learn about wellness, but also to open their eyes to the resources that they have in their community.
When you're surrounded by community members in an atmosphere that's fun, inexpensive, exciting, motivating, it makes the whole process so much easier, and it makes it a process that people want to come back to again and again and again.
We also want to empower the youth of Fall River by making them full partners in our health improvement efforts.
Our program, Teens Against Drug Abuse, TAGA, is an amazing addition to the health and well-being of the city of Fall River.
Teens Against Drug Abuse 2 years ago was successful in the adoption of an ordinance to ban the sales of tobacco products in all of our pharmacies. With that success, I think they felt that they could move ahead in some other areas and now are tackling prescription drug abuse.
The different types of prescription medications out there, such as opiates, stimulants, tranquilizers, stuff like that.
When I see youth who have worked with us when they were in high school, go on to college, and then choose to come back to Fall River to make a difference, that's something that gives me lots and lots of hope.
I think Fall River really needs to understand that health is really at the base of all the things that need to happen to make this community a more viable place to live.
We've come a really long way. People from outside our community are saying that the work we're doing matters and is changing things.
Fall River has a really bright future because we're tackling some of these problems.
Well, that's Fall River in a snapshot, in a quick snapshot. And Wendy, I'd love to hear you talk a little bit more about that harnessing of the leadership around these initiatives. That was a number of different initiatives. You have a lot of different organizations you're working with and bringing together, and leaders from different sectors. Love to hear you talk a little bit about that.
So first I'd like to introduce my collaborating partners in the room because we seem to be joined at the hip and they all came as well. And they were with me in Princeton. So with the camera is Dr. David Weed, who is the Executive Director of Partners for a Healthy Community. Behind David is Marsha Picard, who is one of the employees of our Chana. Chana is set up a little different. We have 5 employees, and Marsha is our liaison to the schools. She's the school wellness coordinator. And then in the row behind is Mike Hoffman, who represents the Department of Public Health as part of our Chana. So already that whole idea of bringing people from different organizations to form another organization is where we get the power in Fall River. There is not one organization that controls what's going on, but we each come representative of the organizations from which we work. One of the things that we talk about all the time is how is it that we can bring 40 people or 60 organizations to the table and get things accomplished and work comfortably without the normal way people do it, where you sign an MOU and you put it in the file and you know sometime or another they're going to get some kind of grant and you'll write some kind of letter at some point in time and you say you're collaborating. So what makes it different is the whole way we look at people. We decided a while ago when we first began talking about this Robert Wood Johnson Prize and we first began talking about the work that we do, that nobody comes to us with one problem. They might sit across the desk from you and talk about needing food or needing rental assistance. But the bottom line is there's probably housing issues, there's probably family issues, there might be education issues, there might be domestic violence, there might be substance abuse. And if we only look at each person by the one problem with which they present, then we're missing the boat. Today, the keynote speaker said something that was so great. Jeff said that working on collaboration is convincing the other organization that by helping you with your mission, it strengthens their mission. I couldn't have asked for him to say anything better. I think that's going to be like, the Kafka on our back, tattooed on our back kind of thing. That is what this is all about. That recognizing that we can't deal with each person one problem at a time, but we need to deal with the plethora of problems they present. And in order to do that, that means the entire community resources have to be available for people to do that. Now, that said, it also means putting your ego aside. It also means sometimes recognizing that you are not going to get the grant. You're going to step back from that grant and let somebody else get that grant because it's going to benefit your community in a better way. And that's a hard thing to do. especially in this economic time. One of the questions today at the keynote was, what happens when you're competing with the very people we're sitting in the room with? We all compete with each other for resources. But if we could find a better way to work cooperatively and bring those resources to our community and all benefit from it, then we get much further as we go on.
And that's what you did. And it's really nice to see it. Thank you. And the prize was rewarding work that went across the multiple factors. So in this video, we saw things about community support and safety, the physical environment. And I know there were more stories about that we didn't get into the video. And also, of course, the health behaviors. You were working on the physical fitness and the tobacco pharmacy ban. So you're across a whole lot of different issues that require a different level of focus. How did you spread yourself so thin and yet stay so focused that you could get results?
So let me give you an example how a variety of different things brought about an amazing outcome. So a number of years ago, the youth in our community worked with their advisors to come up with a youth bill of rights. We were one of the first communities that actually formalized the process of youth sitting down and saying, we have a bill of rights. These are the things that we expect from our community in order for us to be healthy and live well. And that Youth Bill of Rights was a very big deal, and the mayor signed it, and so many people signed it from the city council. Then, fast forward a couple of years ahead, and our youth, you saw our Teens Against Drug Abuse, TADA, isn't that a great name? So the TADA kids were working with community partners on a pharmacy ban for cigarettes, getting them out of the big pharmacy stores. And they went before, they did a lot of work, they did a lot of PR on it, and they went before the city council, and the city council needed to vote on it. So before they took the vote, one of the city council people looked at the youth and he said, listen, I just want you to know that regardless of what happens, you've done a really good thing. That sometimes when things like this happen, you don't get what you want and you shouldn't be too disappointed. Just the fact that you did this was a really, really good thing. And the city council voted it down. And the kids went to the city council and they went to their homes, and they went to their places of business, and they brought the Youth Bill of Rights, and they said, you see here, you said you were going to protect us. You said you were going to give us a safe city. You said that this was going to be a better place, that Fall River was going to be a place that was safe for youth. You went back on your word, and they voted again, and it passed. So we did want to say to that city council, sometimes you don't get what you want. But that idea of being able to bring in all different aspects of the community to work on one problem is what gives us our power in Fall River.
Great. That's a great story. I love that. And I remember when that Youth Bill of Rights was passed, so that's great. Thank you. So the way this will work is we're going to hear a little bit from Cambridge, and then we'll come back to Wendy, and we'll open up for questions from all of you so that you all have a chance. So I want you to be thinking about the questions as we go forward as well. So to move to Cambridge, very different city, very different place, still in our Commonwealth. Whoops. Getting it queued up. Thank you, Bonnie.
Take the lines back.
Is that? Yeah, we will. But I want to introduce Claude first. So Claude Alex Jacob works for Cambridge Health Alliance, and so we've put him up here. It's the city of Cambridge Public Health Department, Cambridge Health Alliance. So a lot of different organizational affiliations to put to Claude, and he comes from a background with many more, of course, as many of us do. But he's worked in a lot of different places. Some of the diversity he brings is from working in the Baltimore City Health Department and working in the Illinois State Department of Public Health. So city, state, he's got a lot of experience to bring here. Currently serving as the chair of the Cambridge Haiti Sister City Committee. And Cambridge is one of the most densely populated cities in the nation. Over 60 different native languages are spoken in the public schools in Cambridge, which is pretty phenomenal consideration when you think about trying to educate children coming with that many different native languages. And more about Claude, he has completed 5 marathons despite a serious back injury, so which I think is amazing. I'm very impressed. His favorite color is blue in spite of the fact that he's not wearing it. And his favorite season is fall, so we're in his favorite season, so he's shining today. So, Claude, do you want to say a few words to introduce our Cambridge video?
Sure. Thank you, Kitty. This is actually, Kitty and I had a chance to do this road show back in Dallas as part of the National Conference for Health Officers, and so it's good to see you. And we've also traded places because now she's a Midwesterner. I hail from the Midwest, been here now going on 7 years, and so it's interesting. So we'll talk about the land of the cheddar in Wisconsin. So that said, really, this is an opportunity for us to share our story. Again, we talked about Cambridge, and really the thread is about the tale of two cities. So you hear a lot about the Titan universities, Harvard, MIT. You hear about the fact that we are a very densely populated city, the fact that we are in the top 10 most densely populated cities in the nation, the population of over 100,000 folks. But what you don't hear or haven't heard a lot about is the fact that 15% of our residents live on subsidized housing, and that half the students in the public schools participate in the free and reduced school lunch program. And so at the end of the day, it's really to share a little bit about what we've invested in. This is sort of version 2.0 of what's happened in Cambridge over the course of the last couple decades. Back in the early 90s, there was the Health of the City initiative, ironically funded by the Robert Wood Johnson Foundation and the Pew Charitable Trust. And we identified some areas of concern by area residents at that time. So children's health, men's health, and the like. And so what you see now is a little bit of the return on the investment, but also our pivoting to look at what's ahead of us for the next few years and our priorities in Cambridge. So let's roll the tape.
The Roadmaps to Health Prize, it's such a wonderful name because the way we've done our work here really is a roadmap for how do you build collaborations in between the not-for-profit sector, the business sector, and the governmental sectors to produce better results for children and families. The demographics of Cambridge are a little bit unusual. We're really a city of the rich and the poor. We are in the midst of Harvard and MIT, and yet more than half of the children in our school system grew up and live in subsidized housing.
The issues of health disparities and health equity, we've made a concerted effort to address the gaps in health, not only with the kids in the schools, but also with the adults in the community.
We're trying to provide better opportunities for health for all children in Cambridge, and so we're innovating in our school cafeterias and health clinics.
Good morning, everyone. Good morning. Welcome to my where we learn to.
We've been able for a number of years in Cambridge to measure children's BMI and then use that information with families to enable them to make choices for their children.
The PE teachers take their height and weight. Having the data available regarding BMI and fitness testing for the students gives us an evidence-based approach for our health programming. Another thing we're trying to do with our school lunch program is to have some cultural outreach through food. The dish is called Doro Wok, and it's an Ethiopian chicken dish. Including the cultural dishes in the school menu is another way for us to expand healthy choices for kids.
Love having Ethiopian food here. I love sharing part of my identity with my friends, and it's a great, healthy way of diversifying what we're eating. In Cambridge, we're trying to focus on all the factors that affect health, including those like literacy that people don't generally associate with health. The Let's Talk campaign is a series of interventions with families.
The program is a demonstration of why health and wellness is tied to the literacy needs of these children and engaging more concretely the role that parents can play in nurturing the growth and development of their children.
You be creative, so you inspire. The Literacy Ambassador program creates the opportunity for a skilled worker to come right to the family's home and work there with them. Our partners are also working on health equity. One program we sponsor supports healthy living for men of color in Cambridge.
All right, get your handshakes going. The Men's Health League is a group of programs which, under the guidance of the health department, offers a service to men in Cambridge who are at risk for cardiovascular disease, high blood pressure, and stroke. just allows men to really think about their health in a real way. It empowers them to make a difference on their own with our support at the league.
My vision for a healthier Cambridge is that the child that's born in one of our housing developments will end up with the same opportunities to lead a healthy and successful life that the child born in a much more affluent home will have. We know that the prize doesn't mean that we've arrived. In fact, we're very clear that we have so much further to go. But it is validating to know that the work we've done here is being recognized and that we'll have the opportunity to share some of that work with other communities.
Nice work, Cambridge. We'd like to hear more from you. I'd love to hear, again, sort of on that same theme of harnessing the leadership, really focusing on that collective energy and collective power to ensure that you've really hit the mark. And Health of the City, I do remember Health of the City because I was actually sitting on that coalition as a tobacco control program manager back then. So it's great to hear that Health of the City actually helped to lay the groundwork for some of this work around the BMI testing and things along those lines in the schools.
Just wanted to talk about leadership. I did want to acknowledge our narrator is Ellen Semenoff, who serves as the Assistant City Manager for the Department of Human Services. She's also a member of Jeff Levy's advisory committee, so she's on the she's a presidential appointee, and another hat that she does wear, she chairs the Board of Trustees for the Cambridge Health Alliance. And that is my organization of record on behalf of the city. And so it's a very matrix relationship that we have. It's a lot of the out-of-the-box thinking when you try to think about how these different functions and departments and realms connect. So I did want to acknowledge Ellen's role. The other is that I noticed a couple, at least familiar faces in the crowd, and so just in an attempt to connect a couple dots, I see Dr. Nancy Norman, who serves on the chapter Boston Advisory for the RWJF Fellowship. You all already heard about Mike Kaufman, so Mike sends a lot of homework to all of us as local health officers, so thank you, Mike. And David Weed, who, again, it's a little bit like Waldo. Where's Waldo? David's all over the place. And so David and I serve on a community advisory for Harvard Catalyst, and so, again, it's just a small world.
But he's ours.
And he's yours. Okay, I understand that.
Just want to make that clear.
And of course, Valerie, who's up in Everett, and Valerie and I were over at the Cambridge Health Alliance as colleagues, and so it's just interesting when I come to these conferences to see familiar faces. That said, one of our functions in public health is about connecting the dots. It's about that fourth essential service, about mobilizing partnerships that work. And so it's in that space that we help to, at least in collaboration with the Margaret Fuller Neighborhood House and the Cambridge Family YMCA, set the tone for this process. So the organizational record that actually applied to the Roadmaps for Health Prize is the Margaret Fuller Neighborhood House. So they're a community partner. They literally abut our building. Because we've had an incredible track record in helping us to at least design the Men's Health League and push it out to the area neighborhoods and learn some hard lessons about trust and partnerships and how do you share this information and demonstrate value. So they've been a great partner to help us make the case to other stakeholders. Because we do have this convening power as a health department, it's allowed us to not only respond to the policy orders and requests of the City Council, not only to respond to the requests of the City Manager, who serves as the Chief Executive of Record in Cambridge, but also to work and demonstrate the value and demonstrate to other community stakeholders the role that we play as a partner. So we're a member of the Cambridge Health Alliance, which is a safety net health system. Our office is based in the ground level of the ambulatory clinic. So folks that come in and out of that building have come to recognize who we are as a part of the Alliance, but also as a resource to the broader community. The last comment is that every April, as a part of National Public Health Week, we put on a half-day seminar with the Institute for Community Health, which is, again, another member of the Alliance and a key partner. And so we help to demonstrate the connectivity across different departments and across different networks. And this is a show and tell that we do for graduate students, but we use that as a way to also demonstrate as a part of the application how it is that we do connect these different dots across the Cambridge community for the health of the community. So that's one, in terms of just how we use our convening power, that we value the collaborations, and that partners like the Margaret Fuller Neighborhood House were really the ones to help set the tone. The Men's Health League, the last comment was that they were the applicant of record, for example, to the Office of Minority Health that allowed us to get that grant. So we wrote it, they submitted it, they got the check, I got to hire staff. It's win-win. And so it's really not about us, it's about the greater good. But part of this is figuring out what's the trust. Part of it is being patient with the process, but that's something that we've brought to bear over many years with the leaders in Cambridge.
Great. Sounds like there's a little bit of that carryover to Wendy's comment that she picked up from Jeff Levy about the working on someone else's mission can be a part of working on your mission, actually, and being that umbrella organization of the Alliance, you're able to embrace all of these different perspectives. And so one of the things that I heard, so you have you have a settlement house, you have the men of color, you have the students in the elementary school, so again, and you have the clinical care as well. So you, again, are crossing all of these different factors, and yet managing to stay focused enough in each of those arenas to have successful outcomes. Can you talk a little bit about that? And that's like, I mean, is it really 20 years that you've been working on these things, or, do things move a little bit faster? We need some hope in the audience, too.
Yeah. So, again, we didn't reinvent the wheel. So the point being that we appreciated the history, the role that the advocates have played over time. We appreciate the support that we receive from the city, which amounts to literally 80% of my operating budget comes from the city. The rest of it comes from grants. There's been a commitment there to support our health department. By scale, we are the second largest local health department in the Commonwealth. Again, Massachusetts is a very decentralized public health state. But at the end of the day, what allows us to stay rooted and true to our mission is the fact that we keep our ear to the ground. We use data to make as best of decisions and as informed decisions as we can. But we also make sure that there's some balance between the art of our work and the science that we use to demonstrate how we are effective in our work. So our priorities over the course of the next coming years, we, for example, have jumped on board to become one of the first accredited local health departments in the Commonwealth. So we're in our first year. It's a year-long journey for us. We just completed our community health assessment, for example, revisiting the data and trying to establish the priorities. We're going to pivot, and because we've received input from stakeholders, we've done a web-based survey, we've done focus groups, we've had plenty of opportunities for folks to let us know what they think the priorities should be, but also mirror that with the data that we have to show the burden of disease in Cambridge, which we're a fairly healthy city, but because we have the spectrum between the haves and the have-nots, it's really about making sure that we cover the gaps. What we hope to accomplish over the course of time is not only refocusing and reprioritizing, but also honoring the commitments that we've made and the investments over the course of the last many years. We've been able to move the needle. So our work around childhood obesity, the work around disparities with the Men of Color Task Force, our work around the wellness initiatives citywide. We are proud of the work that we've been able to bring to bear, and this is just one opportunity to share that with each and every one of you.
Okay, I'm going to pause here and see if I have some more questions for Wendy and Claude, but I'd like to see if you all have, if anyone has questions for them about the work that they're presenting here. Okay. A few more minutes to think about it. Some more questions to Wendy and Claude. So, I think one of the questions I have is, we've talked about how you've been recognized for the work that you've done. You've gotten a prize. Some of your programs have gotten grant funding that's sponsored this. But for people in the room who don't have those resources, who haven't received that credibility and that recognition, and maybe haven't been able to garner some of the few competitive grants that are out there right now, can you offer any support to people? How do you keep people inspired and moving forward in the face of, I know Wendy, you and I were talking a little bit about funding this morning, so in the face of that decreased funding or maybe not having all the resources that you wish you had to be able to do this work, how do you keep people inspired and moving forward on this kind of work? We all know it's not easy.
I think that what's working for us is that there are a number of people that come to the table that are incredibly mission-driven, and we seek out those people to be part of us, because if they are mission-driven about what they're doing, it spills over for the rest of us. I also think that we very intentionally have a big vision. Right now we are beginning our next strategic plan, our 5-year strategic plan, and one of the interesting things about it, Dave Weed is the one who puts the plan together, well, not the plan together, but the process of the plan together. And I was asked to chair one of the committees on homelessness and families, and one of the things we were able to do was to bring people that are not sitting on our collaboration into that process. So all of a sudden there are new people sitting at the table talking about what Greater Fall River Partners is going to do, but they're not yet connected to partners. But as they're sitting with us, they have a real interest in homelessness. And as they're sitting with us and they're hearing the work that we're doing, they think about the work that they're doing in their silo, in their organization, and it just becomes clear, you know what, I should be hooking up with these people because I have more power this way. I have more ability to advocate. I have a bigger voice and probably have more funding if we look at it all together. So we had our first meeting this week, and some of the people that came to the table really didn't know what partners were, but they did know that we have a big problem with homelessness in the community. And just by sitting with them, by the time they left the meeting, they were turned on to the idea of, you know what, I got to get my organization to come sit and be part of partners, and I want to be part of that table as well. So making sure that everybody is clear about what your mission is and understands that there's room in the mission for everyone.
That's a great statement, just to see that there's room at this table for me, and that matters so much to have that open arm. Yeah, Claude, something more for that?
Just adding to Wendy's comment, back in Princeton, I recall a question like this, and I was thinking about a spin on the acronym, BMI, Body Mass Index, but that's not the answer here. It's really about the intentionality of partnerships, so being more intentional. And for us, it's been a great way to demonstrate how we can serve as a catalyst. I really want to acknowledge the contributions. So Stacy King, whose name you may recognize, she's also going to be doing a presentation at the upcoming conference of the American Public Health Association, but she, within my staffing structure, has been the catalyst. She serves as the Director of Community Health and Wellness Programs in our department, and one of her main functions is in establishing and nurturing these different relationships that we have across the fabric of the Cambridge community. So the school community, the nonprofit community, the faith-based community, you name it. Because of her programming that touches across a different spectrum, she's been able to at least establish and maintain these relationships. But it requires energy, it requires engineering, it requires being intentional to make it happen. It requires being patient about the time invested in establishing these partnerships. And so for us, it's been great. The challenge has been with the economic downturn and the increasing competition for grants, for example. We've had to figure out ways to identify the opportunities for a win-win. So is it better for the Margaret Fuller House to apply for a grant than for us? Well, of course. I mean, strategically, you have to be more intentional about it. Is it better for us to just take up more programming or space in Cambridge, or is it better to at least do the work and share in the rewards? And so that's something that we've had to think through. It's taken time for plenty of meetings and plenty of meetings and plenty of meetings, but what we get out of it is a better product. And so if you can tolerate it, if you have the bandwidth, if you have the track record, a lot of this goes into the soup. It's not always an outcome that bears getting the grant award. You may find out that you make the short list. We've had plenty of misfires, but we've learned. And each step along the way, we debriefed to figure out, well, what didn't work here? All right, let's focus our energies in a different place. By the time we got the Men's Health League grant award, we had already missed out on 2 other grants earlier in the year. And so we went back to the drawing board, figured out exactly what our focus should be, and just work with our partners. And at least that's part of our story.
I also think that one of the things that works for us is that we give to the community, that it's not all about asking people to sit with you and do something together. But part of our structure in our Chana is that we use our money and we hire employees. So for example, Marcia is the school wellness coordinator. She walks into the schools and organizes 10 family fun nights that are all about fitness and nutrition that we support and we pay for. So the school is very happy to have Marcia come in and work with them, because we start out by giving something and we say, this is what we can do for you. These are the things we can bring. And these aren't really super expensive programs. Lots of people that are working with the programs come as volunteers to support Marcia to make it happen. We have an opportunity for community agencies to do resource work there and to have a resource fair so that they can be part of it as well. But when the school sees that we are willing to use our resources to support their mission, it changes our relationship with them. And it's not just the schools, but youth organizations and rec centers and health centers and things like that as well.
I just add one comment, only because it is important about reinvesting in community. So we have taken our dollars, whether it's the prize award or just our own budget, to administer mini grants, because it magnifies our reach across the Cambridge community. And we found that to be a great way for us to not only build capacity, but also really focus and mobilize our resources around our obesity efforts or our disparities efforts with men's health, for example. So it's been great to at least use those dollars to create those win-win scenarios, and our partners look for that. Just to make sure that it's not just us as a city department or an entity of the Alliance taking up more oxygen in the room, but also giving back.
And what's interesting is that we now are approached about different things. There's a big issue in Fall River about attendance at school, and they're putting together task force. And it was a normal thing for them to speak to a member of Fall River Partners to be part of that, to inform them and talk to them about how to do this, because they see us as a real player in the community.
That's great. Okay, question?
Yeah, I do have a question.
And in the interest of networking, why don't you say your name and where you're from as we go through?
Okay. My name is Claudia, and I am a graduate student at Boston College. I'm studying social work, focusing on macro, and I'm an intern at the Department of Public Health. So I'm really glad to hear about all your success, and it's really inspiring. I guess I was wanting to hear a little bit more about something that you may have experienced as a failure or a missed opportunity, and what you learned from that.
Pause for a minute, and I'll interject a little story, and you can each think about it, because I'm glad you jumped back to that, because I was thinking about that when Claude was talking about the failures of the men's task force funding, and that they learned from that and kept going. So when we were doing the presentation at NACHO, the National Association of City and County Health Officials, this summer, it was 3 of the prize winners, and Claude was representing Cambridge, and then we had Karen DeSalvo, the Commissioner of New Orleans, representing New Orleans, and Gretchen Musicant is the Commissioner in Minneapolis, who was representing their prize-winning community. And they were talking about their successful prize and the various different things that led to that. And someone came up after the presentation and told me, oh, well, we applied for that and we didn't get it. I said, well, I heard from a lot of communities who applied, went through the process of applying, and found that the process of applying actually was a very good learning experience because of the collaboration necessary to sit at the table and talk about the efforts. And then I hear, well, it was just one. I was the grant writer. It was just me. There wasn't any collaboration in planning for this. There's a little bit of a pause. The tape stopped for a moment, and then it started. Maybe that's why we didn't get into the finalist stage. I mean, the prize really did recognize the kind of collaboration we're hearing about here, and when it's not present, it does take all of us to work together. If we're not working together and making room for people to come to the table and join us in the effort, then you won't achieve quite as much ever as when we're working together. I see them with their hand up. Yep.
So my name is Valerie Spain, and I'm the director of Energize Everett, which is a Mass in Motion funded community in the city of Everett. And we did apply for this round, and we actually made it to phase 2. And we didn't get through. But I have to say that the experience of applying
because we brought all our coalition together. There was, not only did we wind up getting like all these people came together who knew the history of the city and they could talk about it, and we got it in. Now we have these 2 documents that talk all about how we got to where we were and then what our vision was going forward. And I feel like they're documents and it's experience that we can use now to vision, and of course we'll apply again.
Yes.
But but I think that I found it to be a really great experience for everybody, and it really brought the community together in a way that I think people were surprised. We wound up with a video, and tears were shed when the video was shown, and it was very I thought it was very empowering for everybody.
I think we found that the validation of sitting together and finding out that the work you've been putting your heart and soul into, and not always succeeding in. I mean, you don't get every grant, every initiative doesn't work, but I don't think we look at those, you use the word, I think failure, I don't think we look at that as a failure. I think that it's just a bump in the road as we move forward. I think that part of this is realizing that you're not going to get everything and that everything isn't going to work, but you keep on throwing solutions at the problem until something sticks, until something's going to happen that's going to bring about a difference. When Robert Wood Johnson came for their site visit, we were told that we needed to put together a collaboration of 15 people so that we could sit with them. And we had a really big problem because we had 40 people that wanted to be part of this discussion and to sit at the table. And like many other things that happens in the community, when we said to people, well, you know, we only need 15, then it was everybody saying, okay, fine, I'll step out, it's okay. It's like everybody was willing to step out because they had that sense that we work together. But when we sat there with the Robert Wood Johnson people and we had to articulate everything that we're doing and how we got to where we are, it was the most empowering for our coalition. That meeting ended, Robert Wood Johnson people took off, it was in the middle of February, and they left, and we stayed in that room. It was celebratory, because we felt really good when we hear from person after person that the things we're doing makes a difference, and an outside source is looking at us and saying, you know what, you are changing. You are bringing about sustainable change to your community and to the people of Fall River.
Claude, go ahead.
Interesting question. I would also agree with Wendy that I describe it as a bend in the road or the importance of a dry run.
Oh, that's good. I like that.
And so we have 3 little ones at home, and so the exercise of waiting for when baby's ready to come, you end up in these scenarios where, oh, is it today? All right, we go, oh, false alarm. And so what I've learned over time is that, okay, so I know the road, I have my bags packed, I'm ready for the next thing. In this equation, when the fact is that we had applied to the Robert Wood Johnson Foundation many moons ago for a health disparities initiative to support the men's health work. Goose egg. It didn't happen. We did not get the funding. For whatever reason, it just didn't happen. And what we took from that experience was, all right, we've got to figure this stuff out. And so different process, different funder. The outcome was that we were funded to create the Men's Health League, but this is really based on the history of the work that had been done in Cambridge for many years before then by the Men of Color Task Force. So for us, the take-home message was, well, we figured out, we didn't have all the answers, but we knew that we had to tweak the package, we had to figure out how to make a presentation, we had to put some data together, all the ingredients that go into the equation. And as you know, that applying for any grant application is a whole exercise. The easiest part of it is putting it in, then you've got to nurture relations, figure out tactically how to sort of manage that process. There's a whole lot to it. There's a whole science to it. So the point is that don't see it as a failure. For us, again, I would coin it as a dry run, that what we didn't get back then allowed us to refine and to focus our efforts and our energies, even recognizing the role that the Margaret Fuller House could play in the equation. That, had we been successful the first time when we applied, then we probably wouldn't have thought about the value of the partners to help us, at least in creating this win-win. What we have today is a robust program. It's been great for us to not only scrape our elbows and bump our heads and even to help to demonstrate the value of the program itself, but also we're looking forward to the next pieces, the next era of the programming with input from our partners. So don't see it as a failure, see it as an opportunity to improve on the quality of what you can put together in the future.
And an opportunity to enhance what you're doing. My agency, United Neighbors, is a community collaboration agency. We're one of the community connections, the 22 that are in Massachusetts. I see my colleague sitting here who was awarded today. Congratulations. And we have 1.5 staff. Me and a 20-hour-a-week admin person and a couple of facilitators that run some Nurturing Fathers programs and do some work for us. However, because we are connected to partners, what we are able to do from our office is extraordinary. With the help of partners, we support a coalition that is working with families that are living in motels. We have 3 motels filled to the brim with about 200 kids that are outside of the community, not near public access to transportation or grocery stores or the ability to get to transportation any way, shape, or form. And I could never do that with 1.5 staff members. But I can do that as part of partners. And whether it's my coalition or it's Partners Coalition or it's one of the other organizations that sit at the table, their coalition, we say it's all of our coalition. Everybody's happy to claim that this is our coalition. But the bottom line is that by sitting together at the table and harnessing everybody's power to create a new entity gives us the ability to make change in Fall River.
So you've really overcome that turf issue of coalition. I see another question. Let me jump here. So start with, I'm sorry, is it Nancy?
Nancy.
Yes, thanks. And then we'll go back.
So you're mentioning partners made me think about my question. Because for a minute there I forgot you were talking about Greater Fall River Partners for a Healthier Community, correct? Mm-hmm. So often in my world, when you hear partners, it means a totally different entity, one that I think others in the room probably know what I'm referring to. So I'm curious for both of you, especially also Claude, I know where you are and I know where your offices are and I know that you're in the same building with a teaching hospital. Do either of your coalitions involve teaching hospitals, major hospitals, or health plans? And then also for Kitty, have any of the applicants ever included those members of the community in their application process for this? Because it's, well, let me answer the question and then I'll...
The hospital members as
Yeah.
members of the community.
Yeah, hospitals and or health plans.
Okay. Claude, do you want to start?
So, thanks for the question, Nancy. So we are, our health department, this is now 17th year as a part of the Cambridge Health Alliance. We're part of the Safety Net Health System. I report to the CEO of the Cambridge Health Alliance, who's also the Commissioner of Public Health for the City of Cambridge. There was an enabling statute that created the Cambridge Public Health Commission back in 1996. And there are very few models, I mean, one that looks exactly like us, that's really the City of Denver. That said, so our office space physically, we're part of the Cambridge Health Alliance. I am a card-carrying member of the Cambridge Health Alliance, but I also fulfill the functions on behalf of the city by running the health department. So we have a physical location tied to Cambridge Health Alliance. When we created the Men's Health League, one of the first positions that we also created was a navigated care function, which didn't exist in our department. So to help the guys understand about insurance, make appointments, keep their appointments, identify a primary health care provider, all that is something that we've had to build over time using the models within the Cambridge Health Alliance. So we work very closely with the providers. There are a number of patient advisory groups tied to CHA, so we have different touch points to provide input. But our building, if you just think of one-stop shopping, we have the WIC program administered there, we have a dental clinic in that building, not under us, but under the Alliance. There's a mental health clinic. All this is part of the same physical space where our office is located, and we're co-located with the Boys and Girls Club, with the Early Childhood, Early Head Start, an after-school arts program. So the ecology of that building and the way that the Alliance provides our support administratively, it allows us to have these seamless boundaries where we're able to at least access the providers. We're in Massachusetts, which again, 99% of residents have some type of health care coverage. So all that goes into the equation. So I think, Nancy, to your question, it's about our linkage to the delivery system. I have access to providers, so the pediatricians, the folks in occupational health, The folks in infectious disease, we run the tuberculosis clinic on behalf of the Cambridge Hospital because that's staffed by our nurses. So there's that clear interface, but that's not the norm for what we see. And the last comment is that there's a grant application, for example, the Prevention and Wellness Trust Fund, which is here in Massachusetts. So we're working hand in hand with our partners in community affairs, focusing on the priority areas around the burden of chronic disease. And so it's where we are. It didn't happen overnight. And we still have to demonstrate what is a challenge. It's the return on that investment, because folks look for that automatic return, which in a lot of our work, it doesn't happen overnight. You've heard about the investment about men's health. I mean, it's only now that we're able to we're at a place where we have the capacity to show how that works, but it didn't happen overnight.
Well, and I'll just jump in and say that all of the prize winners had a connection to clinical care, without question. Whether or not a hospital was the primary applicant, I would have to double check on not the prize winners, but on any of the other applicants. But certainly there was clinical care and integrated care systems involved in each of the prize winner communities. It was, again, the work that the prize was recognizing was work across the four key factor areas that we recognize. So clinical care access is one of those key areas, and certainly they were all demonstrating their connection to that piece of the process. But I'll come back to you to tell you a little bit more. Did we have any hospital applicants or leadership members who were hospital players? But certainly we all
This is
did.
when I
And
always
we-
feel
I
like
have a
it's
question back.
city mouse and country mouse. Okay, you ask about teaching hospitals. We live in southeastern Mass. There's no such thing. We have two hospitals that are connected in our area. One is South Coast Hospital System and one is the Stewart Hospital. And both of them have representatives on the CHNA. We do a lot of work with them, worksite wellness, smoking cessation, farmers markets, the Fall River Fitness Challenge. They are players on the team as we go forward. But what you are describing is definitely city living.
Yeah.
What we have is definitely outside of city living.
Yeah. So, good. So I had a question in the back I wanted to get to.
Well, it's not actually a question, it sort of segues nicely into geography. My name's Lois Donis and I work at the Northern Berkshire Community Coalition. So we're as far west in Massachusetts as you can get. We applied for the Roadmaps Prize a couple years ago and didn't get it. But what came out of it was a great collaboration between partners in Berkshire County, because we're challenged by a small population. And those relationships that were developed helped us to later apply for some DPH opioid abuse prevention monies. And we now have the Berkshire County Opioid Abuse Prevention Collaborative. And now a lot of those folks are working together on the Prevention Wellness Trust Fund grant. So it really helped people to further open up, to form more relationships, to form more collaboratives, and to really do some good work together. So it was a catalyst for some great things.
So I'm hearing one of the strategies is coming through loud and clear. What's one of the successful strategies of doing this work? It's truly the collaboration, deep collaboration, meaningful, involving not token representation from different sectors around the community, but really representing true buy-in from the partners who can sort of absolve their turfy organizational identity as they come in the door to sit at the table and join hand in hand with the mission of the organizations going forward. And that seems really, that's coming through very strongly.
And I think we seek on two levels. We seek organizations that can connect with us, but we also look in the community and we find the individuals that are doing extraordinary work and seek the individual and hope that they will bring their organization with them. And sometimes that's a better way than just approaching the organization. Because if you find the person that you can turn on, that you can sit face to face to and say, let me tell you about these incredible things that we're doing to make the world a better place, and you can be a part of it because you're already doing some of that, then when they get just as turned on as you do, then it's a much easier step to get them to come to the table.
I'll go to Claude, and then there's a question. Yeah?
Just another comment that, for example, the fact that we physically are across the street from a public housing unit and we've focused on the burden of tobacco within that, housing unit. Again, and what the win-win for us with the delivery system is that whereas the providers are interested in offering smoking cessation courses and tying in some of the patients to the Alliance, we've been able to at least work with decision makers around the housing authority to help that authority go smoke-free. So it's a win-win because it's not only focusing on the patients but also helping to move the needle so that you address the broader environment.
Conversation with a woman the other day after we had been at, we watched a lot of coalitions come and go through the North Cleveland Community Coalition's time. I had a conversation with a woman after we left a meeting that was kind of just dragged us a little bit, and she had said to me, you know, you need to be better about, at the coalition, North Cleveland Community Coalition, about really telling people why it's so important to be at your table. She says, because I don't ever feel this way leaving your meetings, because you have expectations about what is happening, and the partners that are at the table have expectations. Even if there's no funding involved, there's some greater community collaboration. And I've heard both of you kind of touch on that a little bit, and I didn't know if you could maybe go a little further.
Great question. I would just press it by saying that, as Kitty alluded to, so my career has taken me in different places, so you sort of learn this stuff over time. Ran community programs out of a hospital on the west side of Chicago, so you learn to sort of understand the neighborhoods and how do you demonstrate the value of these programs. In Baltimore, which was a pretty intense experience, it was really about understanding not only the sort of dyad that exists in Baltimore, but also figuring out how do you broker these conversations to create these win-wins. But for work we're doing in Cambridge, we've found that A, you're not always going to be competitive with a lot of these grant applications. B, it is about managing the expectations. You know, a lot of our time and energy around a number of these initiatives, it is spent around the table just to get to know and trust one another. You have to, you can't fast track that process. The resources, the dollars help, but at the end of the day, we've had initiatives that were birthed because we all agreed to still stay at the table regardless of the money. So it's being clear about a purpose. It's being very clear about the expectations. It's being very transparent about what is and what isn't. And so it's the kind of thing that you have to invest staff time. You have to invest your own personal time. You have to at least be very clear about what could come of some of these initiatives, whether it's obesity efforts, tobacco, mental, whatever the case may be. And so it is about investing in that space, the relationship, but also carrying it forward. A lot of the pressures that we're feeling these days have to do with sharing across multiple jurisdictions, and then that's nothing new here. And so what that requires is having new conversations with partners that you hadn't even thought about before, but you've got to be genuine about it. And so that takes some time, and it does take an investment by, again, your own self or your staff or other stakeholders.
I think part of it is also finding that point of connection and that point of overlap. And I think that when we approach problems in the manner that I mentioned before, that we don't look at one problem, but we try and look at the spectrum that surrounds that problem, then it's much easier to bring people to the table. Because when you're talking about, you know, I want to work on a housing problem, well, you know what? I want the smoke-free people there. I want the diversity people there. I want the substance abuse people there. And if I don't say that going into it, that what you're bringing to the table is going to help me solve the problem, then I'm not going to turn them on to that. But if I can make my case that the work you're doing, that you're already doing, is going to help me achieve my goal, and I'm going to help you achieve your goal, is great. But don't get me wrong. Not everybody is part of us. One of the major organizations in Fall River works on their own. And has, although there's a representative that sits with us on the Chana, we are not involved in collaborative work, and they're very happy to do that. And they're very large, 500 employees, lots of money, very powerful, and do really great stuff. And that's their choice to be there. And I think that we invest energy in trying to bring everybody to the table, but there's also a point in time when you move on to the next person, when you know that perhaps this isn't the path. Maybe that's, what did you call it? The dry run. Okay, so maybe that the dry run was trying to get them involved, and perhaps they're not interested. But making the case that even though our missions look different, they are really about the same thing is what this is about.
Marianne, question?
So yeah, Yeah, my question is
Do
about...
you want to tell people who you're from?
Sure. My name is Mariana Islam, and I work at Community Catalyst, and I'm actually I manage the provision of technical assistance to our Roadmap to Health grantees, which is another part of the work of the county health rankings and roadmaps. So my question is around culture keeping, right? So who, how do you develop, maintain that culture that you're talking about, and who are the kind of culture keepers? You talked about your work, over a 20-year kind of time span, and just kind of curious and wondering like how that level of intentionality has been kind of maintained in your work.
Great question. I guess, again, so we're from the PRC, right? The People's Republic of Cambridge. And again, so folks have been known to have an opinion. I mean, and the fact that we've had advocates that have helped to hold our feet to the fire. So recognizing these issues from years ago that weren't the flavor of the day. So whether it's work around childhood obesity, Men of Color initiatives, I've had the fortune to work on men's health in other states. And so coming to Cambridge, this was already here. It was just a matter of trying to mobilize the resources, organizing it, and identifying the right partners to make this work. So it's a great question, but there are a couple different answers to it. There's the culture within the organization, so working with our staff and the talent that we have, and how do you make this stuff work, because you have to have the capacity. But then there's a broader community. And they're not mutually exclusive, so you have to recognize where it is that you have staff that can help navigate, but also how do we pay attention to the needs of community so that it keeps us honest, keeps us on task. Just like we're going through this community health assessment process, which requires looking at the data, but also asking the input of stakeholders to say, all right, is this what we really see, and what should be our priorities?
I think also that in our case, when you live in a smaller community, Fall River has 88,000 people, right? Okay, so 32 spoken languages, high levels of poverty, 90% of our kids are on lunch programs. But I think that we also have lots of people that remain in the community. Just recently, we celebrated the 20th anniversary of our organization, and Mike Coughlin made an unbelievable historic video talking about the beginnings of the Chana, of Partners, and how we've gotten to where we are now. And although I was part of the process of being interviewed, I really wasn't involved at all. Mike and Dave pretty much did it, and I saw it for the first time at the celebration. And my husband, who never comes to anything, and I made him come to that, turned around afterwards and he said to me, this was really great because I could see how things have moved from 20 years to today. There's something very powerful in connecting to your history every once in a while and taking a step back and saying, what were we saying 5 years ago? What were we saying 15 years ago? Where were we 20 years ago? And what's the path we took? And it was very interesting that someone from the outside perceived it as a tool for us to move forward by looking at our past and looking at our accomplishments and seeing the points where we can celebrate. It was an effective tool as we move forward into the future.
An excellent way to work with that history coming forward. And there is a tool like that's in the Action Center at the Roadmaps to Health as well. If you're looking for tools and activities to do in your community that might help bring you to some of these conversations, I think there are plenty there to choose from. Bonnie, I'm going to ask to show the composite video at this time, and then we'll do a couple of final words and give you some hints as to where you can find more about these programs at APHA, where we have a number of presentations.
Winning the Roadmaps to Health Prize is a validation of the work that we have done as a community. The way we've done our work here really is a roadmap.
It's also an opportunity for us to build on the work that we're doing.
People from outside our community are saying that the work we're doing matters.
We have something to offer, even beyond ourselves, to teach people where we come from.
In the Upper Peninsula of
It
Michigan.
inspires our community to be confident in themselves,